Hello, everyone. My name is DR.DELCORRAL. I'm a plastic and reconstructive surgeon that focuses his practice in gender affirmation surgery. This morning, we'll talk about some options for facial feminization recovery. This is meant to be a preoperative guide for some patients who are about to start their consultation process for facial feminization and want to learn a little bit more about the procedure and the different options that there are for facial feminization. This is a presentation primarily based on my experiences and my advices. Each individual surgeon will have a different point of view and different ways to do things. So please make sure that you follow your plastic surgeon recommendations. But today I'll share with you the way we do things at our Center for Gender Affirmation. There are a number of aesthetic goals when we talked about facial feminization. In general, we divide the face in thirds in order to be able to classify, understand what changes we can produce in someone's face that will lead to a more feminine outcome. In general, we strive to achieve a shorter forehead with minimal supraorbital bossing and very less pronounced orbital bossing. There's also a convexity of the temples, and the forehead tends to be a little bit more vertical. When we talked about options for improvement of the upper third are things like forehead reduction, and this can be done through an incision for a hairline advancement or an incision in the back hitting in the scalp, and we'll talk a little bit further about these options. A forehead setback or reduction, which means that the supraorbital bossing is going to be reduced, and that can be done in different ways depending on the classification of the orbital bossing. And also a brow elevation is a very feminine, a very aesthetically pleasing procedure that can allow to elevate the forehead and elevate the brow into a more natural feminine appearance. When we travel down into the mid-face should ideally have a straight nose, straight dorsal aesthetic lines. There should be a very thin mid portion of the bridge of the nose with a slight tip rotation. And the cheeks should be fuller with a enhanced fullness and a bit of a shadow underneath the cheek to translate into a better volume. In the middle third, this can be easily done with rhinoplasty. There's also a possibility of increasing the malar volume either with implants or with fat grafting. Lastly, the lower third of the face is very important in facial feminization. We strive to have a short nose to lip distance with fuller lips. Traditionally, the lower lip should be fuller than the upper lip. We want to have a slightly elevation of that upper lip to the point where the patient can, when they smile, they have what we call incisor show, which means in repose, the patient can have a little bit of the teeth showing because of that elevation of the upper lip. And the chin should be narrow. The gonial angle can be pronounced or it may not be. Gonial angle orientation is really not a male or feminine trait. There are many patients who have a pronounced gonial angle and they have a very feminine lower third of the face. So this can be arguable depending on your individual goals as a patient. So when we talk about the forehead, we primarily are talking about the brow bossing. So if we look at the skull of this patient, you can see that this increase in orbital bossing in the supraorbital rim right above the brow can produce several changes into someone's forehead. In males, this angle is more acute, which causes this sort of elevation above the brow. It also changes the transition between the forehead and the nose versus a feminine skull in which this angle is going to be more obtuse, creating a more vertical forehead and very, very minimal brow bossing as well. There's also a change in the shape of the orbits, with female orbits having more of a traditional rounded orbit, and this can be modified. So as you're evaluating your options for forehead reduction and you have made the decision that you would like to proceed with some sort of forehead intervention, then you have to think about the options of incisions. There are multiple options. In yellow, you can see an incision we would call a bicoronal incision. And in green, there's a pretracheal incision or hairline incision, and both of them have their advantages and disadvantages. If you pick the incision right along the hairline, the green line, this is called a pretracheal or a hairline incision. And the advantage of this incision is that, as you can imagine, if the incision is placed in the top of the forehead, this can be advanced anteriorly, and some of the skin can be removed in order to reduce the forehead. If we create an incision in such location, the disadvantage is that it can potentially be a little bit more visible depending on the hair pattern of the patient and the thickness of the hair. And also, as the patient ages, if they decide to, if they lose hair at this location, that scar can become more visible with aging. Now, the other option is to place the incision on the scar where it says the yellow line, the B line. And the advantage of this is it can be easily camouflaged. The disadvantage, of course, is that you can have areas of hair loss because you are making a scar where the follicles are. And there's a very specific way when we're creating a scar in the forehead or in the scalp, and how do we try to avoid trauma to the follicles to allow for the scar, for the follicle to grow within the scar. But there's no doubt that any hairline incision can give you scar loss, or a scar alopecia, as it's called. There are other types of incisions, as is shown in red here, or C, which are the typical incisions made for a endoscopic brow lifting. And this is done through vertical incisions that can be placed in the forehead to allow for elevation and pulling back. You know, unfortunately, endoscopic techniques are traditionally very difficult to get covered, sometimes through insurance, but for some patients who are not using insurance, this may be a great option to hide scars. Now, after surgery, I want to make sure that you understand that any type of scar in the scalp area, or really anywhere in your body after surgery, you will have some temporary numbness as the nerve sensation can be compromised, usually temporary. We talked about this shock alopecia, or the hair loss. There is something called a shock alopecia, which traditionally, when someone's having an incision in the scalp, you can temporarily have hair loss. And it's usually not in the area where it was operated, I mean in the scar itself. It can be a little bit more posterior. That is called shock alopecia. And it can really take some patients by surprise, because while all of a sudden you have this hair loss on the back of your scalp, and that is usually due to changes in the blood flow in the scalp. This is usually as we are elevating the tissue and advancing it, although we may not causing direct trauma to the follicles, there could be a change in the blood flow and in the phases of hair regrowth. If this happens, usually the follicles go into a temporary shock, and in a couple of weeks, they'll come back. So this is usually not something that is permanent, but it needs to be obviously discussed with the patient. You can also have some eye swelling after surgery, and you may be able to see or feel this is called endotines. Some surgeons use different techniques for brow lifting. Endotine is one option where we put this very small absorbable devices. You can see that act as small hooks in order to hold the scalp to allow it to heal and keep the brow elevation. There are other techniques that uses bone fixation or some sutures that we can use in order to provide the brow elevation. But traditionally, the brow elevation can be a little bit more remarkable or pronounced at first, and this will tend to decrease and relax over the first few months after surgery. Now, when we are evaluating a patient for a forehead reduction or a setback, your plastic surgeon most likely will ask you to get a CAT scan. And depending on the size of the frontal sinus, the thickness of the walls of the frontal sinus, then we can make a decision of what technique are we going to use to provide a setback. And there are different techniques depending on what the patient wants to achieve. But this is sort of how the CAT scan looks like once you have it done. And you can see that in blue, there is a trace of the frontal sinus, and you can see how the frontal sinus on the picture on the right-hand side, we can actually mimic and play with the computer, depending on how we fracture the bone, how many millimeters of setback we will be having during this reduction. This is also very useful in patients who are seeking genioplasty. As you can see here, this patient had a genioplasty. We have planned the actual dimensions of the genioplasty and the plate placement as well. And you can see a lot of the surgery can be planned prior to surgery and share with the patient. Many plastic surgeons use three-dimensional technology. This is a picture taken with using the Vectra system. And this is a camera that allows you for a three-dimensional picture. And we can actually compare your before and after surgery before you have the surgery. So using the CAT scan data that we have, we can actually provide a 3D rendering of how the bony changes may look prior to surgery. And this is done by many centers. This is not a new technology, but it's very helpful to help us communicate with the patient to see what changes are they going to happen. Now, it is important for you to understand that this is an approximation of the outcome and not rather a very specific 100% outcome proven from this technology. So it is great to show forehead and mandibular changes. It's a little bit more tricky to show changes in rhinoplasty, for example. So when you're evaluating this and you receive a picture like this, make sure you review it, make sure you look at the bony changes that happen. If you have any concerned areas, discuss it with your plastic surgeon. You know, sometimes things like brow lifting or cheek filling using the vector system modifications is not as reliable as showing you some of the other aspects, such as the forehead and the jaw, as we previously mentioned. This is a patient who had a forehead feminization. You can see here, there's been a change in their shadows and the lighting of the forehead. You can see overall, this is a feminine outcome. There's some femininity to her jaw, as well as her cheeks and the forehead by performing certain modifications. And you can see how beautiful that result can be. And this is a patient only a few months after her surgery. Now, if we look at patients who have had brow bossing correction, you can see here that although this patient had a pretracheal scar in the hairline, she has a very thick hairline, and you can really visualize that incision very well. But through that incision, we were able to address the forehead and make this much more less pronounced. Of course, this patient had other subtle changes, but you can see here in the oblique view how that the shape of that forehead has been modified. Not only the brow bossing and the orbits, as well as the brow position. You can see the tail of the brow, much higher elevation. But you can see the actual shape of the forehead has also been modified, changing that transition between the forehead and the nose. And this is another patient where the incision was placed in the back of the hairline. This patient was happy with her hairline itself. She has very nice hair, so that will camouflage that scar. But you can see here, again, changes of the convexity, not only of the brow, but also in the forehead. There is a change in the reflection of the light, as well as you modify these changes. The brow, tail of the brow, or the peak of the brow is significantly higher at this location. And of course, some other subtle changes in her jaw to allow for those feminine contours. And you can see here the AP view, even more pronounced that shape and change of the forehead. And you can see her overall change and shape of their face into a more oval and less square as before. So in terms of the post-op recovery, many patients, depending on the extent of the facial feminization, may have a procedure that is outpatient versus a 23-hour recovery. If we're doing any type of rhinoplasty or forehead setback, your surgeon may want you to do no nose blowing, because we want to make sure that the area where the frontal sinus was repaired seals before there's any increase in bacteria going through in that area. If you blow your nose, you want to keep your head elevated. Usually there will be a drain in the scalp that will be removed 24 hours later. And you have to be patient. There is a considerable amount of swelling that happens after these procedures, and it generally can take, generally 6 months to be completely resolved. And when we talk about jaw surgery or rhinoplasty surgery, that swelling can persist for up to 12 months after surgery. The brow will actually descend into a more natural position, as we mentioned it before. The endotime will tend to reabsorb at 6 months, and then you may see some intermittent hair loss. Now, it is different for you to have shock hair loss versus alopecia hair loss. There's two different things. In this patient, you can see there's a hairline incision, and there's almost an area where there are no follicles in that area. That is called scar alopecia. And that usually happens months after the surgery, where you may have an area where the scar is, where there's no growth of the follicles in that area. And that's certainly a possibility. But usually this can be treated over time, can be excised, and there are other methods to use to improve this. Shock hair loss is something that is completely independent on where the scar is. It can happen on the back of the hairline, and it's usually self-limiting and resolved in a couple of months after your surgery. In terms of the complications, This is overall a very safe procedure. Things that are common are going to be the shock hair loss that we mentioned. There will be some numbness in the top of the scalp. There could be some changes in the movement of the brow, and those are usually temporary due to the frontal branch of the facial nerve can be sometimes bother during the procedure, and there could be swelling in the nerve that could cause some asymmetry in the brows, but this will tend to be very self-limiting over time. Things, complications such as infection or bleeding or keloids are actually quite rare in this type of procedure. So let's talk a little bit about genioplasty or jaw surgery. As we know, the genioplasty procedure, it can be done through different methods, but traditionally in our practice, we do this through an incision inside the mouth. And when we make this incision, we have to obtain exposure of the entire lower rim of the jaw. And to do that, we need exposure. And we do that by making 3 small incisions inside the mouth and being able to approach this and access the lower rim of the jaw through this. And we use some very fancy equipment to be able to make the bone cuts as precise as possible. I use ultrasonic technology to create those bone cuts using those guides and the CT imaging that we showed you before to create a specific contour that was discussed with the patient prior to surgery. And you can see through this incision, we can actually change the position of the jaw and the vertical height, as well as address the gonial angle. And we can use different cameras to make sure that those cuts are being performed symmetric on both sides. So it's a very precise procedure using a lot of technology to be able to have the best outcome. And you can see in this, one of my patients, you can see how the bone has been removed. And I like to show you this on the top of the screen. There's an acrylic guide of the patient's jaw. And this is sort of our plan prior to surgery. And you can see here after surgery, we're comparing what we plan and what we remove. And you can see how specific that ultrasonic equipment can be for those to create those bony cuts. And this is just a patient who had a genioplasty. And you can see here how do we, after mobilizing the muscles around the jawline, you can see that portion of bone is about to be removed in that area. And second video running here. This is just to show how sort of that can give you, after removing that segment, you can see how the change in the shape of the jaw is performed, creating a nicely, very sharp angle. And these are some pictures who had a genioplasty. You can see the befores on the top, more square, and on the bottom, you can see that very nice contour, very, very more rounded shape with a decrease in the height from the lip to the top of the chin. You can see that vertical height has been reduced on both sides. As we're doing this, we can change as we're reducing the bony part, you have to make sure that if you have a patient who has a little bit of extra skin, perhaps a little bit of fat in that area, and if you're reducing the bony support, the skin can become more lax in that area. So sometimes what we generally do is we add compression. We sometimes can do liposuction, but if you're a very young patient, a facelift is not something that we would be indicated. So it's important for you to comply with the compression because we're trying to allow for all that swelling, all that skin redraping to occur after the bone has been altered. So after surgery, you will experience some numbness inside the mouth, especially in the lips or in the teeth. Brushing the teeth may be a little bit, feel maybe a little bit weird since there will be some areas of numbness. You may have some swelling of the muscles of the jaw. So your ability to chew will be a little bit compromised. We ask patients to be on a soft diet for at least 2 to 3 weeks post-surgery. The swelling can take a few months to go away, and patients are usually in a moderate amount of pain for usually 3 to about 4 weeks. You'll have to do some oral hygiene, brushing your teeth using Peridex to make sure that you keep your incisions extremely clean and avoid any infection inside the mouth. So after genioplasty surgery, depending on the extent of surgery and the combination with other procedures, this will be a 23-hour stay or outpatient surgery. Liquid diet, as we previously mentioned, ice is key. You can buy one of these compression facelift garments here where you can actually slide the ice pack to help with swelling. Mouthwash for 3 weeks. Be patient. The swelling will take about 6 to 12 months to completely resolve. And make sure that you understand that the movement of the mouth and the lips will continue to improve over the first 12 weeks, 12 months correction. So you have to be patient, give yourself some time to fully recover. Some of the complications that we can see, among the common complications, you can have some mentalis dimpling. As this muscle comes back and redrapes the jaw, you can have some areas. And this is usually temporary, can sometimes apply a little bit of Botox to make this improve. Numbness can be common. Permanent numbness can be rare and usually can take up to a couple of years. There's a mental nerve that travels very close to the area of surgery, and this can sometimes be bothersome by the surgery and give you some numbness. Nerve injury, it's usually can happen, but it's usually rare that this happens, especially with movement. Things like infection, bleeding are actually quite rare. Mental nerve injury is actually quite rare. You can have some temporary asymmetry of the smile, and that's something that will tend to recover after the first few months, up to the first year after your surgery. And injury in the teeth root is also a possibility, but it's also quite rare, especially in the era of using virtual planning. Some of the other options that are not as involved as changing someone's vertical and length of the jaw is the buccal fat pad recession. And the buccal fat pad is very, very nice because it can allow to change the fullness of the lower third of the face. And you combine this with a lip lift, and you can see you can get a nice elevation of the upper lip, shorten the distance. So we talked about from the base of the nose to the upper lip, creating a much more refreshed, a much more feminine appearance. And you can see here a patient who, here's a buccal fat pad. It can be easily done sometimes in the office. And you can see how that patient who did not have jaw surgery, that lower third of the face appears to be much more narrow just by removing the buccal fat pads. And this is a lip lift result. You can see the change in the fullness that it can happen. The other option is a tracheal shave. Some patients have a little bit more of a pronounced Adam's apple. And this is usually caused by the thyroid cartilage. This projection of the thyroid cartilage can be easily removed using an open technique or an endoscopic technique through the mouth. We usually use an endoscope to actually look where the vocal cords are in relationship to the Adam's apple. And that way, intraoperatively, we can actually visualize the vocal cords and make sure that they're being carefully saved. And after visualizing them, we go ahead and we remove that excess thyroid cartilage. And you can see here, sort of this patient, the scar is placed right at the crease between the neck and the chin. And you can see how that has been reduced. And patients can have a good outcome if you treat the scar properly, you put the scar high enough, even in open techniques. I would like to thank you everyone for watching this preoperative guide about some options and what to expect after facial feminization procedures. Take care. Thank you.